pleased to see you all again. Some from years ago, some from lunch. I had a very different experience. You know, people say they grew up somewhere. I really grew up here because my dad was on faculty in the department starting from when I was 4 weeks old. And so I had you know, in terms of like Howard and Marcia saying, I don't know what public health is, this is dinner conversation. So when you said, you know, yeah, Marcia came over sometimes, and Peter Zandy, I think, developed his fear of my father at some of those dinners. And we would, you know, and so when you were saying that story about what is your research question, so what did I learn? I learned that mostly from my dad, but I was 8. So right now I direct the Center for Mental Health Policy and Services Research at the University of Pennsylvania, where we work very hard to do policy relevant research that we're trying to get into practice. And Paul, your whole presentation resonated so much with me and was so powerful, and is a really important reminder about why we do what we do, which I'll get to in a second. But I'm glad Joe is here, because this was my memory from the department when we were asked for the memory. It was there were all these techniques that were evolving and continue to evolve, and we were learning factor analysis. And what happened was we hadn't got to that part in statistics yet, but Jim said, go learn it anyway. And so we were wandering the halls, really like a gang of rogue doctoral students trying to figure out how to learn factor analysis. And we ran into Joe. We said, Joe, what's factor analysis and how do we do it? And I don't know where he was going. He must have been going somewhere, because he was a very busy dude. And he stopped and contorted his body with his arms and his legs to show us orthogonal versus oblique rotations. And we really felt, or I really felt, like the faculty were extraordinarily available to us and invested in this process and in this mission with us in a way that that I hadn't experienced before, and that was very powerful to me. So what did I learn? Well, so what I do now mostly is school-based mental health research. I work a lot with professionals who work with children with autism. And our biggest partner is the School District of Philadelphia. We do a lot to try and improve the quality of care for children with autism. These are some of the kids, the things we teach them, like token economies, the kids and the teachers we work with. And it is in doing this work that I've realized that everything I learned here is a methodologically rigorous upward extension of Sesame Street, right? Because what matters is who are the people in your neighborhood, right? And I learned this in a lot of different ways from a lot of different people here. So what's the methodologically rigorous extension? Well, if you want to test things in the community, the first thing you need to have is the trust and the partnership of that community. And more than anybody else, I learned that from Phil Leaf, who, you know, you could always find him at 9 a.m. on like a Tuesday night, because he was at the school board meeting, and he was there every week, and he was out visiting with the people who were going to be not just his subjects, but his partners in doing this kind of research. I was a little scared of Phil when I met him. I didn't know where I was supposed to sit, so I waited outside his office for days until you know, he invited me into his office. And one of the things that was really striking to me was, despite his potentially, laconic presentation, were the number of community awards, but also the number of letters, the number of pictures from kids who he had worked with, and teachers that he had worked with, and principals that he had worked with, and public mental health people. And that was a very powerful image for me of that connection that he had made with those people. Well, so if you want to test something in this environment, it's a lot different than testing it in the lab. So the other thing you have to learn is methods to do that. And I feel like everything I learned that I use today, I learned from studies of the good behavior game. And it was so wonderful to have, you know, these presentations from work that had been done in the early 80s of how do we partner with schools to do this? How do we test an intervention in the schools? How do we think about long-term follow-up? And of course, you can set up the study, but then it becomes increasingly complex as you try to analyze the data. And I feel so grateful to people like like Marie Diener West and Karen Bandine Roche and Ronald Brookmeyer, who taught me in a very rigorous way these statistical methods to do that. And then we come back to the department and people like Bill Eaton and Jim Anthony tell us what it means and how you do it. Like okay, it's great that you understand this method in theory. Now what's the practical application of how you do this in this particular setting? And I will tell you it's with developing that trust. I was thinking, Joyce, about what you said. It really resonated with me about trying to make policy decisions. It's because you're able to develop that trust, because you never surprise an administrator, that you're able to affect policy decisions. So, for example, some of the programs that we tested in the School District of Philadelphia are now the standards of care and the accepted curricula and programs for those teachers. Because we're able to convince teachers, the school district, that if they want to maximize academic outcomes, then they need to teach their teachers behavior management. Right? There's like one graduate school of education in the country that has a behavior management class for its teachers, right? And that if we can improve behavior management, we can improve outcomes. And because we do this in partnership with them, and because we've been doing it for a long time, and because we go to them and say, what is it that keeps you up at night? What's the question that's important to you? And we start from there, that we're able to affect those policy changes a lot, which leads me to the last thing, which I also learned from Phil, which is the change you are able to affect is only because of the trust and partnership you develop with the people and the places where you're trying to make that change. And these were extraordinary, like, hard skills that you learn, the things in your tool belt. But the other thing you learn here that I don't think you even realize until you leave are those softer skills and that deep structure understanding of what it means to truly change and improve public mental health in the communities where we want to affect change.